Hey guys, it's Ashka again. Welcome back to my YouTube channel. So in my last video, I touched slightly on my journey to finding my passion for oral healthcare, dentistry, and public health. So today I'm going to talk a little bit more about what oral healthcare is and about what dental caries are, so otherwise known as dental cavities, and then the project that I'm implementing as a result of being a graduate student at AT Still University. So a lot of the time that I spent volunteering at the Good Samaritan Dental Clinic and the various different healthcare research opportunities that were presented during my time as an undergraduate student at the University of Minnesota Rochester really exposed me further to the notion that the healthcare field always takes precedence over the dental field. And my exposure specifically to other individuals' journeys at the Good Samaritan Dental Clinic highlighted two factors specifically for me that were crucial to finding my passion in dentistry. So the first was that dental care is not considered as important to overall health of an individual. And so this is certainly a factor that public health care officials, including dentists and physicians, need to address, as diseases of the oral cavity or the mouth can lead to or contribute to other diseases in the body. So we want to take care of what's going on in the mouth in order to prevent what's happening in the body. So we certainly need to put some importance in dentistry rather than thinking that it is not required to take care of your teeth. And the second factor that I was exposed to at my time at the Good Samaritan Dental Clinic was that dental care is actually extremely expensive and unaffordable to many individuals. Granted, I did know about this fact, but I really didn't see it head on because my family could tend to afford the dental care that we required, and so we didn't really see, or I wasn't really exposed to what other people were exposed to because of the unaffordability of dental care. So that's certainly something that we also need to work towards, and trying to find more cost-effective therapies or alternative options while we find or research those cost-effective therapies. So dental caries or dental cavities are referred to as one of the most common chronic conditions worldwide in both children and adults, and they can certainly be prevented, but they are still considered the most common chronic condition worldwide. According to the National Institute of Dental and Craniofacial Research, a decrease in dental cavities has been observed over time amongst the American population. However, the same organization further asserts to the notion that dental caries and other oral health care issues still remain common amongst other population groups. One such population that remains the most underserved and are known to have the most dental diseases compared to any other population are individuals with special health care needs and intellectual disabilities. A survey administered in 2005 pertaining to children with special health care needs indicated that approximately 78% of this population had not received any dental care in the past 12 months. And additionally, 10.4% of the children with special health care needs did not receive all of the dental care that they required per the symptoms that they exhibited. So provision of oral health care to individuals with special health care needs and intellectual disabilities requires dental professionals to have specialized training that's acquired through additional education and access to a multitude of resources that many professionals and caregivers simply don't have access to if they are running a clinic that's designed for quote-unquote normal people. And so I think that's where that divide comes into. That's why this population is the most underserved when it comes to dentistry, just due to the lack of training and the resources available to provide care to that population. So this whole video touched base on what oral health care is, what dental cavities are, the incidence of oral cavities and how it can be prevented, but the video also touched on how it is evident that dental public health professionals need to develop and implement additional effective caries prevention and oral health education programs that alternatively aim to reduce the dental cavities, improve other oral diseases, and increase overall oral health knowledge of the population while we try to find those cost-effective therapies. So that's certainly something that we need to do. I hope you guys enjoyed the video. If you have any comments or questions, please comment below. I certainly look forward to answering your questions and receiving any feedback. And then if you have any suggestions on other videos that I should do, please do let me know, and I will definitely consider doing it. Thank you.